In today's world, you can't eliminate risk. But the good news is you can surround it, and no one can help you do that quite like G4S.
Emergency management is important for any organization, but it can sometimes take a special significance in a 24/7 healthcare environment where almost anything can happen at any time of the day or night. Emergency management specialist Lyle Kwan says hospital patients may be especially vulnerable during emergency situations.
They're very vulnerable, and sometimes they can't be moved. So how are you going to take care of these people in the case of a true emergency? How can you find them a place of refuge, a place where you can continue the care for them? There's so many questions that need to be answered in relation to that. Also, just staff alone. How many staff need to evacuate? Why do they need to evacuate? Who needs to stay? If we're talking about critical care, there may be 3 or 4 people that have to stay with that patient until they can be moved safely. So emergency planning is a key function of any health organization, along with business continuity. So how are they going to continue in that vein?
Ken Close says the color-coding system that hospitals use to classify specific types of emergencies is hugely beneficial, not only in terms of preparation, but acting quickly.
You have code black, which equates to a bomb threat. You have code purple, which would be hostage taking, and code red, fire, and so on. There's a series that are primarily more focused on like infrastructure type emergencies, and then you have 2 or 3 that are basically clinical emergencies, such as cardiac arrest and that sort of thing. And what the organization has done is it actually sends out email blitzes every single month based off of the different codes we have. And you take that information, you actually disseminate it to your staff, and you make sure they understand and they learn. And then that way, if there is an emergency, hopefully people have a general understanding of what's happening. The second piece to that is sometimes they will actually do actual exercises within that month based off of what the code is. So then it actually gives people the hands-on learning in regards to understanding it better and being better prepared. If you ingrain these processes in people's minds in regards to the basic things they need to do, I think what ends up happening is those do come out through your subconscious, so you have a little bit of it, but almost every emergency you need to adapt to what's actually happening at the time.
In those high leverage situations, you always fall back on your training. So the more preparation you can get, the better. In those situations, you want to be able to fall back on what you've already done. The advantage of actually taking the time to train is that you're prepared for these situations when they happen. One of the old sayings goes, it's too late to prepare when you're already in the situation. So training is beneficial just to make sure that you're ready to deal with anything that may arise.